Bismillahirrahmanirrahim. This is Dr. Usman Akhtar and welcome to my YouTube channel. Our today topic is acute rheumatic fever. An acute rheumatic fever is a type 2 hypersensitivity reaction where our own immune system start to produce some antibodies against another antigen, but that autoantibodies start to destruction of our own cells, lead to different condition, different symptoms, which is called acute rheumatic fever. Now if we look at the pathogenesis, now for example, if someone get infected with the streptococcus pyogenes, which usually cause throat infection. So this streptococcus pyogene contain one specific protein which is called M protein, and this M protein, when sensed by our immune cells, they come and catch this M protein, and in response to that they produce certain antibodies. So these antibodies will destroy the M protein of streptococcus pyogene, but as well as it will destroy our own tissue, because some of our tissues like heart, joint, skin and brain, they contain certain molecules which exactly look like M protein and they mimic with this protein. So this is called molecular mimicry. So because of the molecular mimicry, our own cells will be damaged by these autoantibodies. So this condition is called acute rheumatic fever. Now if we this is very important point to understand. Like for example, if we say all the patient infected with the streptococcus pyogene, either they will get all patient will get rheumatic fever. No, only 3% patient will get rheumatic fever if they get throat infection with streptococcus pyogene. Now for example, if it damage our heart, so in heart there will be pancreatitis, the endocardium will be damaged, the myocardium will be damaged and pericardium will be damaged. If it attack our joints, there will be migratory polyarthritis. Let me explain this point. This is very important point. Now, first of all, in acute rheumatic fever, the larger joint, the knee joint, the ankle joint, the elbow joint, shoulder joint, they are mostly affected. And this is another important point, that this arthritis is usually asymmetrical. This is another important point. Another important point is, now for example, the ankle is inflamed. So after some days, the ankle will be normal, but the shoulder will get abnormal. Means this arthritis keeps migrating from one larger joint to another larger joint. So it is important to understand the migratory. Another is, this is reversible. These arthritis are reversible. After the disease, these joints become very normal and retain its normal function of the movement. Another is subcutaneous nodules. And subcutaneous nodule is the manifestation of the skin. Another is erythema marginatum. And in erythema marginatum, the lesion, the margins are get red. Erythema mean red and marginatum mean the edges. In chorea, these are the manifestation of the brain damage, which is a purposeless involuntary dancing movement, which is called chorea. Now, as we discuss the clinical feature and the pathogenesis, how we will diagnose the acute rheumatic fever. For that, we have one criteria which is called Duchenne-Jones criteria. The Duchenne-Jones criteria consists of major factor, minor factor and essential. So in major, there will be pancreatitis. All three layers will be inflamed. Let me tell you another important point. In myocardium, if we look at the myocardium, in myocardium there will be a Chauve's body. So these Chauve's bodies are pathognomic for the acute rheumatic fever. So this is an important point to remember. Another is migratory polyarthritis, subcutaneous nodule, erythema marginatum, and chorea, as discussed a bit earlier. Another is minor, so there will be fever, arthralgia. No, look at this point. This will be polyarthritis, there will be inflammation. But if there is no inflammation and if there is only pain, then the minor criteria will be added. But if there is polyarthritis, then we will not include this. So arthralgia, if the pain is only present, then we will add the minor criteria. History of rheumatic fever, or we can say history of sore throat. Another is if the acute phase reactant are raised, like ASR is raised or CRP is raised. ASR is erythrocyte segmentation rate and CRP is acute phase reactant. These are C-reactive protein. Essential criteria, there will be increased ASO entry, streptolysin O titers. There will be increased, these antibodies will be increased, and there must be positive throat culture. So look at this. This is important point. How we will diagnose this point? So if there is one major plus two minor plus essential criteria, this is the most standard one. But some will say two major, one minor plus essential. Some will say 5 minor plus essential criteria. But I still think this is important to remember. One major plus two minor plus essential criteria is the diagnosis of acute rheumatic fever. And treatment, the acute treatment should be treated symptomatically. Like if there is fever, give paracetamol. If there is carditis, give the proper steroids or proper treatment. If there is pain, give painkiller. So we should give some symptomatic treatment. But penicillin still play a key role. Penicillin is a drug of choice for a treatment as well as for the prophylaxis of acute rheumatic fever.